Hello everyone, I am Dr. Susanta Chatterjee, Head of Department of Ophthalmology at New Bombay Hospital, Vashi, and Director of Dr. Chatterjee's Ulwe Eye Clinic.
Head of the Department of Ophthalmology, Dr. Chatterjee is a cataract, glaucoma and refractive surgeon. And other than being a very competent and successful doctor, he is a fun-loving, outgoing and a typical Bengali foodie. He was kind enough to join me for a chat today. Welcome, Doctor.
Firstly, I would like to thank Madam for inviting me on such a beautiful platform, and thanks for the kind introduction.
Friends, post-lockdown, the extreme use of electronic devices has taken its toll on our eyes. Be it with family, friends, meetings, or the students, everything being online, the increase of gadgets or electronic devices has increased tremendously, resulting into a very common disease, computer vision syndrome. Without wasting much time, I would request Dr. Chatterjee to take over and explain in a very lucid language what is this computer vision syndrome, how it takes place, how we can prevent it, and what is its remedy.
I'll be speaking on a topic called computer vision syndrome. So before I start, I'd like to say that on this ongoing pandemic, most of us are stuck inside our house since quite a few months. We are not able to go out, we are not able to travel, can't mix with our friends. So to keep touch with your near and dear ones, the only medium is laptop, mobile, or the screens with which we can stay in touch with each other. And how do we spend time? How are we spending time? Is by increased time in front of the screen. So it has been seen that, and studies are also showing that because of this increased screen time, lot of people are developing, from kids to young people, even the old people, all generations are affected by eye problems. A certain kind of eye problems which was there before, but because of this pandemic has increased significantly. What are these eye problems that people are developing? One is redness, watering, decrease in vision or blurring of vision, pain in both eyes, and fatigability, means tiredness, because sitting in front of the computer or laptop for long hours. Now these problems combinedly is known as computer vision syndrome or digital eye strain. So what can we do to prevent this? Well, it's very simple. Firstly, unnecessary use of screens should be avoided, specifically for the kids and the young ones also. Unnecessary screen time should be avoided. Secondly, because a lot of companies and softwares, architects, we need to sit in front of computers and work for long hours, maybe 10 hours, 12 hours, whatever it is. Hence the posture in which we are sitting is very important. By the word posture, I mean there should be a proper backrest. The computer or the laptop should be at least 1.5 meters away from you, and it should be little bit lower than your eye level. It should be placed little bit lower than your eye level. This will help in decreasing the strain to your eyes. Another way how we can do is, a lot of people who don't wear glasses, means they don't have any number in their eyes, they should use an anti-glare glasses. That will help in cutting off the radiation that is generated from your computer or the mobile, specifically the blue light. The blue light is very harmful to the eyes. To cut down that blue light, we need to wear an anti-glare glasses. Third thing, what I have observed, or you may yourself can observe, that when we are glued to the screen or the mobile, we don't blink our eyes. Blinking of the eyes is very important because the cornea on the eyes doesn't have any blood vessels. So how does it get nourishment? It gets nourishment through the tear film as well as the atmosphere, oxygen that is there in the atmosphere. Because we don't blink, there is a decrease in tear film. Hence, dryness of the eyes develops very fast. So, please do increase the blinking rate. A normal blinking rate should be 15 to 16 times per minute. But it has been observed that when someone is glued to the screen, the blinking rate becomes only 1 to 3 times per minute. I'm not saying it is somebody's fault, it is a completely involuntary action. But if we keep in mind this thing, we can make sure that we do blink while using or sitting in front of the screen. Another rule is there which is called a 20-20-20 rule. What is this rule? Work for 20 minutes, take a break and close your eyes for 20 seconds. Look something distant, not a TV or screen, any object for 20 seconds. So this breaks the chain that the muscles undergo because of working continuously in front of the screen. To break the chain, we need to take breaks, and this 20-20-20 rule will help you in again or continuing long hours in front of the screen. So every 20 minutes do take a break. Generally, the working ambience in the working place in which we work, it is always air conditioned. So it is very important to make sure that the vents of the AC, air conditioned vents are not positioned or not placed, or you are not getting the jet of air to your eyes, because already because of the air condition the humidity is less, and again if the air forces to your eyes, that also will lead to blindness, that also will lead to dryness, and always again you will have difficulty in vision. Another thing is the light, that the light that is projecting. This projection of the light, you should make sure that it should not come from front or behind. It should be either from the side or from the top, because this light, if it is projected from not proper positions, it will give you a lot of reflections from the computer screen, and that again will cause harm to your eyes. So these are the few basic things which we can do, and if we are aware of, we can definitely prevent from developing this computer vision syndrome, because in our stage or in our level we can't ask you to stop using computers, but these are the small things, if we follow, will literally help you. Now coming to the treatment pattern. The treatment pattern, I give it a name of 3 B's. Number 1, take breaks, frequent breaks, very important. Number 2, keep blinking. Blinking is very important, and that is the key. And third, use some good lubricating eye drops. Now when I am saying use some lubricating eye drops, my advice is, if you are having the symptoms like pain, redness, watering, tiredness, fatigability to your eyes, decrease in vision, blurriness, you should pay a visit to your nearest ophthalmologist and let the doctor decide which lubricating drop should be given to you, because lubricating drop doesn't have any side effects and it just nourishes your eyes, provides moisture to the eye, and prevents all these symptoms that you develop from long hours of computer use. On that note, thank you.
Thank you so much, Dr. Chatterjee, for your valuable insight on this topic. And I'm sure all of us will be benefited. So friends, take care of your eyes because आंखें ही होती हैं दिल की जुबान. See you next week. Bye.